Cardiovascular disease, CVD, is a leading cause of death globally, encompassing a range of conditions that affect the heart and blood vessels. These conditions often result from atherosclerosis, a process in which fatty deposits, or plaques, build up on the walls of arteries, leading to narrowed and stiffened vessels. This can impede blood flow, causing various complications like heart attacks, strokes, and peripheral artery disease. Types of cardiovascular disease. Coronary artery disease, CAD. The most common type of heart disease, CAD, occurs when the arteries supplying blood to the heart muscle become hardened and narrowed due to plaque buildup. Heart attack, myocardial infarction. A heart attack happens when a coronary artery becomes completely blocked, preventing oxygen-rich blood from reaching a part of the heart muscle. This can cause the affected tissue to die if not promptly treated. Stroke. Strokes occur when the blood supply to part of the brain is interrupted, either due to a blocked artery, ischemic stroke, or a burst blood vessel, hemorrhagic stroke. Peripheral artery disease, PAD. PAD is the narrowing of arteries in the limbs, usually the legs, leading to reduced blood flow and causing pain, numbness, and even tissue damage. Heart failure. This condition occurs when the heart cannot pump blood effectively, leading to symptoms like shortness of breath, fatigue, and fluid buildup. Let's now discuss combating cardiovascular disease with stents and statins. Stents are small mesh-like tubes that are inserted into narrowed or blocked arteries to keep them open. This procedure is often performed during angioplasty, a minimally invasive technique that involves threading a thin tube or catheter with a balloon at its tip through the artery to the blockage site. During angioplasty, the balloon is inflated at the blockage site, compressing the plaque against the artery walls. A stent is then placed to hold the artery open after the balloon is deflated and removed. There are two types of stents. Bare metal stents. These stents provide a scaffold to keep the artery open, but can lead to re-narrowing over time. Drug-eluting stents. These are coated with medication that is gradually released to prevent the growth of scar tissue and reduce the risk of re-narrowing, restenosis. Stents can significantly improve blood flow, relieve symptoms like chest pain, and reduce the risk of heart attacks. However, they may also pose risks, such as blood clots forming around the stent, requiring patients to take antiplatelet medications to prevent such complications. Statins are a class of medications that help lower cholesterol levels in the blood, particularly low-density lipoprotein, LDL cholesterol, often referred to as bad cholesterol. High levels of LDL cholesterol contribute to plaque buildup in arteries. Statins inhibit an enzyme called HMG-CoA reductase, which is involved in the production of cholesterol in the liver. This leads to a decrease in cholesterol levels in the blood. Lowering LDL cholesterol levels reduces the risk of developing plaques, thereby lowering the risk of heart attacks, strokes, and other cardiovascular events. Statins also have anti-inflammatory properties and can stabilize existing plaques, making them less likely to rupture and cause blockages. While statins are generally well tolerated, they can cause side effects in some individuals, such as muscle pain, liver enzyme abnormalities, and an increased risk of diabetes. Regular monitoring by a healthcare provider is essential to manage these potential risks. Prevention and management of cardiovascular disease involve a combination of lifestyle changes, medications, and medical procedures. Key strategies include a healthy lifestyle, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins while avoiding trans fats, saturated fats, and excessive sugars. Engaging in regular physical activity, such as brisk walking, swimming, or cycling. Avoiding tobacco use and limiting alcohol consumption. Managing stress through relaxation techniques, mindfulness, and social support. Medical management. Regular checkups with a healthcare provider to monitor blood pressure, cholesterol levels, and overall heart health. Taking prescribed medications such as statins, antihypertensives, and antiplatelet agents as directed. Procedural interventions. Undergoing procedures like angioplasty and stent placement when necessary to restore blood flow. In some cases, coronary artery bypass grafting, CABG, may be performed to reroute blood around blocked arteries. Cardiovascular disease remains a significant global health challenge, but advancements in medical treatments like stents and statins have greatly improved the ability to manage and prevent severe complications. By combining these medical interventions with healthy lifestyle choices, individuals can significantly reduce their risk of cardiovascular events and lead healthier, longer lives. Understanding these options empowers patients and healthcare providers to work together effectively in the fight against heart disease.